So the first question really is this patient ready for treatment? And there's a tendency in the healthcare system, I think, to do treatment to people without really assessing what is the readiness of that patient to engage in therapy. We know the long-term prognosis of patients in FND can be poor, although the quality of the studies is not good in terms of, most of the studies were looking at patients who were untreated in terms of these cohorts. So I don't think we actually have a good sense of a long-term prognosis, but earlier studies did show that 40% of patients are either the same or worse at follow-up. And so many people do remain chronic. And so I think a first important step is to triage to see which patients might be suitable at that time for treatment. And that can change over time. And things that we look for are diagnostic agreement. So the patient has to kind of agree they have this problem and have an absence of really strong perpetuating factors that keep them stuck. So for example, if somebody has really severe debilitating fatigue that limits their ability to do physiotherapy, right? If they come in for treatment and they're out for the whole week in bed after 1 hour physiotherapy, their system isn't actually ready to dive into a physiotherapy-based program. So maybe we have to work on activity tolerance first. So the referral for treatment is a very individualized process. It also depends who the clinician has in their team or their community who can work with these patients. And so the options would be motor-retraining physiotherapy. There's really good guidelines for occupational therapy, speech-language pathology, as well as psychotherapies. And often patients really benefit from a combination of all of those together.